Thank y'all so much. Hey, good morning, everyone. As you can tell, I am not Congressman Jim Clyburn, but on behalf of our incredible Majority Whip, I am Steve Benjamin. I'm the Mayor of Columbia, South Carolina, and it's a real pleasure to fill in for him as a moderator for this important conversation. The Congressman sends his best and his regrets that he couldn't be with us here today. But on behalf of him and the members of the Congressional Black Caucus, I do welcome you to the annual Environmental Justice Braintrust. This year's Environmental Justice Braintrust focuses on the unique, very unique relationship between access to broadband and environmental justice. The FCC estimates approximately 24 million Americans lack access to high-speed internet. These households are disproportionately in rural areas and in communities of color. Racial differences in actual adoption, whether it be access or affordability issue, also persist. According to Pew Research, 79% of white households have home internet access compared with 66% of black households. Disparities in broadband are directly linked to Americans, to disparities in social determinants of human health and overall well-being. We're talking about who will benefit from advances in telehealth, public health, and environmental technology. As we talk about the connection between broadband access and environmental justice, consider the work of Medicare Connections in South Carolina. PCC is a nonprofit providing support services and for technology, broadband, and telehealth to providers in rural and underserved areas of South Carolina. One of their biggest challenges in their telehealth programs are finding broadband service providers who will provide residential services to patients. Solving PCC's challenges could be a true game changer for many of the communities that Congressman Clyburn represents. A new study from Harvard suggests that counties with broadband access are significantly more likely to have their residents receive treatment via telehealth programs compared to counties with less than adequate access to broadband. Last week, as you think about Hurricane Dorian and the threat it posed to the coast of South Carolina, telehealth programs and services for providers like the Medical University of South Carolina continued, while most healthcare offices were closed across all along the coast of South Carolina. This is an example of what broadband access can do for many communities across our great country. As the Congressman is known for saying, America doesn't have to be made great. It's already a great nation. Our task is to make sure her greatness is available to all of our citizens. Today we're going to have the opportunity to hear from experts in the field on the importance of broadband access and the fight for environmental justice and possible solutions to move us in the right direction. Before we hear, however, from my expert panelists, I want to personally take a moment to thank some of the folks I know who played such a huge role in making sure this is a success and all the work that Congressman Clyburn does 365 days a year. I want to thank Dr. David Rivers from Medical University of South Carolina, who spends a great deal of time bossing me around, and I appreciate it. It's always wonderful advice and counsel. Dr. Melinda Downing from the U.S. Department of Energy, Dr. Era from Allen University, Dr. Saber Slaughter, Monique Hill, Associate Professor at MUSC, and Mr. Lloyd Moore for the continued role in the development of this Braintrust. And also want to thank Congressman Clyburn and incredible staff for all the work that in making this Braintrust a reality. Now we're going to hear from our expert panelists. And I may call them up one by one, but in this order, we're going to have them all present for 15 minutes. And then if we're lucky, we'll have enough time for a little bit of Q&A. First, we're going to hear from Mignon Clyburn, former commissioner of the Federal Communications Commission.
Thank you. Thank you, Mr. Mayor. Good morning, everyone. If you were to believe a lot of the headlines and read a lot of the reports and follow commissions like the FCC, you would be extremely excited right now. You know why? Because you are living, you've got the bragging rights to say that you were alive at the beginning of the fourth industrial revolution. Now, anybody who has those bragging rights should be excited. You're seeing, computer capacity just explode. You're seeing and being able to communicate with people thousands of miles away. You can keep in touch with your doctor, your lawyer, because sometimes you might need your lawyer with the doctor, but that's another panel. But literally at your fingertips, you can be here, there, or around the world. This device that just buzzed is your connection to just about everything. But the mayor mentioned a number that the FCC has offered to us to say that 24 million people right now do not have broadband as we know it, high-speed internet access that will give them the possibilities of just being as connected as most of us are. I'm going to affirm to you, as a person who is on that commission for almost 9 years, that that figure is grossly inaccurate. Because when you speak about the people who actually subscribe, that actually have continual access, that can actually afford it, that 24 million easily goes to over 100 rather quickly. If you are an individual with a Lifeline phone, a program, incidentally, that is in trouble, and you get a subsidy every month to have a dial tone, and yes, to have broadband access, your plan is limited. You are often limited to 200 texts and 200 voice minutes. So tell me, if you need to speak to your doctor and your only means of communications is a wireless device, that 200 minutes will get eaten up on hold. Those 200 texts will be eaten up by your child telling you, I'm coming home, I'm this or that. So at the end, after 10 days, you're not necessarily connected, but we count you as connected. If we pass you by way of infrastructure, if broadband is literally at your doorstep and you can't afford it, we count you as connected. So when you talk about the environmental side of the equation, I contend to you that no matter what the figures say, no matter where broadband is available, for over 100 million people, it is not continuously accessible. And that is a problem. And that is the reason for these conversations, because there are 100-some million people that don't have a continual service or don't have continual access. They are disproportionately seniors. They are disproportionately those who have some form of disability. They're disproportionately impoverished, and they are disproportionately people of color. The very 4 pockets of individuals and communities that could benefit from a so-called 4th industrial revolution. And so I'm not going to take up all of my 15 minutes because I want this to be interactive. I'll just say this to you because I've got hopefully a multi-point plan that all of us should consider if we truly want to change the current paradigm. But I'll just leave with this, and please ask me about my multi-point plan. The first 3 revolutions, first 3 industrial revolutions, that some of us, if we remember a little bit of history, and I only remember a little bit, the historian is not here on this panel today. When you talk about the invention of the cotton gin and what that did for, to mechanize and to make, to ensure more efficiencies in terms of cultivating crops and moving us into a truly industrial economy and going into this third and then third, now fourth revolution that is allowing us to have unlimited, in some cases, if we can afford it, access to opportunities. The first 3 did not have lasting, sustainable, or equitable benefits to our communities. There are too many pockets of poverty and despair in our nation for us to be excited about this fourth revolution and to be passive about being excited about this fourth revolution. So I contend to you, if we want the first revolution to be different from the first three, then I say drop the R and be a part of evolutionary change. Because it's going to take an evolution, a disruptive mindset with all of us in order to make sure that, as a congressman likes to say, that the opportunities that are literally at our doorsteps and fingertips, that they are accessible, affordable, and ubiquitous. Thank you.
Thank you so much, Commissioner. Now we're going to hear from Dr. James McElligott, who is not only the Executive Medical Director of Telehealth at MUSC, the Medical University of South Carolina, but also is the founding Executive Director of that program. I guess a pediatrician by training. So we look forward to hearing from you now, please.
And this young lady next to me says she might need me. She's on baby watch, apparently.
Yeah. Any minute now, so if she starts breathing differently, then all of us panic. At least we have a doctor. Yeah, that's true.
No, and I serve as one of the board members of Palmo Care Connections, what I wanted to start out with saying is that I've been blessed with opportunity, both from mentorship at my Medical University of South Carolina, opportunity from state funding, from federal funding, from grants that have come a long way. And the reason for saying that is I'm very appreciative to be here, and I know people like to open with that, but I think I mean it more than most. And I started down a road of trying to work in health disparities, like a lot of well-meaning people, but you quickly get sort of faced with the realities of the academic setting or just how much impact you can really have. I did a few studies on the I-95 corridor of South Carolina, which unfortunately has some not so positive names associated with it, like the corridor of shame and things like that. And I brought some of that research and data on children to some of the people in this room, and they thanked me for the work, and you could just see in their eyes that it wasn't enough, right? So, but why am I so positive? Why am I so happy about all of this? Is the opportunities that have afforded me have been amazing. The funding has come, grants have come. So what I did when I first got some support to try to do something about how bad off from a healthcare perspective the kids were in these portions of South Carolina was we looked at telehealth. And as a pediatrician, the first thing I looked at was school-based telehealth. And that's where me in Charleston as a pediatrician, I made some partnerships with some school nurses in Williamsburg County, a very poor county in South Carolina, and a little bit up the street in underserved areas of Charleston, and just try to connect and via video. Got some USB stethoscopes and fancy cameras, and just tried to make it work. But you know what? When I showed up in King Street, South Carolina, and Hemingway, South Carolina, when we plugged that stuff in, I found out that work had already been done, and there was great internet out there. And I was floored because I was advised that was going to be hard. I was going to have to get millions of dollars of contracts. But what I realized was there was a huge opportunity there. And then as the state has invested in more telehealth, and because I got sort of involved early and from a grassroots approach, and I guess people let pediatricians do things they typically I'm non-threatening, I guess. I don't know. So I kept being pushed further and further into leadership roles and be in charge of more collaborative things across the state. And the opportunities kept growing. And it was amazing, but I've had this sense of unsettled urgency ever since, that the opportunities are there, but what you do once those roads are built is a lot of work, and it's a lot of community engagement, and it's too big for any one person. And as broadband, as these plans get put in forth, I have very naive optimism that this is going to work, that we are going to cover our country, and we're going to reach some of these households. But as the former commissioner has been saying, the devil's going to be in the details. What are we going to do once it's there? And we want to be out in front of it in some of these areas. Some of us have been lucky enough to be charged to work in these areas. So I went out to King Street and Hemingway in Williamsburg County, And I wrote these papers that talked about how bad off the area was, you know. But what happened when I got there? I met the most wonderful people. And I, you know, being, most of the state is 2/3 Caucasian. This area is 2/3 African American, and certainly the infrastructure there historically has been neglected. But there was nothing stagnant about the community. It was very active, and I learned that there's no community too small to have a health improvement plan. They all have one. If you come in from the city and think you're teaching them something, you're missing a lot. So as I learned about this community and set up, I quickly regretted sort of the pessimistic articles I had written and those kind of things. So we set up the video, we set up the connections, then we decided to connect to every school in the community. And thankfully, it was only 10, where there's like 100 in Charleston, so it was a little easier to manage. And to kind of come full circle here, on that particular program, just this week in JAMA Pediatrics, which is a big journal as a academic pediatrician kind of approach, we got published 6 years of data showing that we've reduced close to 40% by the third year of intervention children using the ER for asthma in that community. In Williamsburg, as county itself has been mentioned, there was an editorial written about it. So you're really doing good if you get an article published in a prominent journal. You're really doing very good if you get an editorial written in that same journal. And so we're very proud of that. And it just mentions Williamsburg in a positive light over and over and over again. But it took 6 years of work, and it took 6 years of trust and funding when the grant ran out. If the state hadn't supported telehealth, I'm not sure that I'd be able to do it. If people hadn't already put broadband into those schools so I could hit the ground running, I'm not sure I would have done it. So you can see why I just feel lucky, and so I have to get out in front of these next opportunities. And the community engagement plans and what you're gonna do is so important. So as we look forward to, a ton of work has been done to connect broadband into healthcare sites. And South Carolina, because of Pulmonary Care Connections as a primary lead, has really connected clinics and schools throughout South Carolina. We're not bad off. And I imagine other states are making progress too. But the households are our problem. I know places where kids have to go to do their homework, they drive to the McDonald's. That's the only place in town that has the internet that they can use. And so how are we gonna do this? Well, we've developed a diabetic remote patient monitoring program as another one that I think is worth talking about, where you go home with a glucometer if you have diabetes, and you push your glucose reading to a cloud, and the healthcare team from afar can look at it, and they don't have to wait to your next appointment in 1 month or 3 months. They can call you and say, by the way, change your medicines, or talk to you about your diet compliance, or do whatever it is that's needed. It's a wonderful program, and surprise, surprise, it works. But the devices are expensive. Guess what? The first round, we sent them home, and they had to be connected to their household internet. Well, that didn't get us very far in rural South Carolina. So now we have cellular-enabled devices, but still, that's not even great in those areas too. So these interventions are there. And what I'll tell you is a lot of other places are doing this, and they're building them out of the healthcare system. They're seeing their own patients, and you're getting the high adopters of healthcare interventions. You're getting the people who have means, and you're getting those people who want convenient care. And that's accelerating the industry of telehealth. And there are gaps. You could see it happen, those early industrial revolutions. You could see that some people are succeeding and some people not. And if we're not active, I'm afraid that will happen. I will say, because of the investments that we had in our state and the lucky environment I've been in, the model that we developed for that program was very decentralized. It was, when the state legislators supported funds for telehealth, we knew that the value case had to meet that audience, not necessarily my CEO. And luckily at MUSC, the president and the CEO, they got it. They gave us permission to go after health disparities work, even though it was not yet reimbursable and all these kind of things. And that's not true everywhere. But you know how the model ended up? We actually didn't start monitoring MUSC's own patients until about a year ago. For the past 4 or 5 years, we've been monitoring patients in rural communities. There's 30 different federally qualified health centers and family health and free clinics that the patients are monitored. We work through the nurses and the staff, in the local community. But who's reading the glucose readings and following an algorithm to tell you when you should call the patient and do all these things? It's a team of wonderful, caring nurses that sit 20 feet from my office. And so this local partnership with sort of a central hub is a really important factor that the business model is not going to have you do unless you come at it from the perspective that the reason you're doing this is to serve that population. But it's not rocket science after that. It's glucose in a cloud that's too high, change the medicine. It's all can be done, but if the will isn't there, I do worry. The last thing I want to say, because I would love to leave time too, and as you can probably tell, I can talk about this till the cows come home. But one thing that the healthcare industry didn't see coming and that makes me smile as that sort of naive pediatrician with an executive medical director title now, is collaboration across competing healthcare systems and across communities. It's happening in good ways and it's happening in not so good ways. So for example, your doctor on demand or type of things with your cell phone. Most of the time, almost all larger health systems have a version of this, but they actually outsource most of the manpower. Like 90% of the calls will not be a doctor at that health system. It goes to this call pool of doctors that are working in their home. And they should be licensed in your state, but they could be anywhere. So there's a collaboration that could fragment your local community. So we're working on that in our area and trying to partner together. But in other ways, this diabetic program, we're partnering because the local community can't have a panel of monitoring nurses in every one of their clinics. They have to band together. But one thing I'd like to talk about just very briefly is Telestroke is a very successful across the country program. We're very proud of our program in our state with the larger health systems working together. We have just about 100% of the state's population within an hour drive of expert stroke care. And if you know anything about a stroke, the quicker you get the care, the better off you are. And so we love that metric. We believe it's contributing to even our improving in health statistics. MUSC ourselves cover about half the hospitals in the state, and Prisma Health in Columbia covers a big chunk in McLeod, and another big health system covers another area. And they're very fast. They respond in 5 minutes to the, if you stroke and you show up, do not drive to the near urban center in South Carolina, just go to the nearest hospital because we're probably connected. But what people don't realize is that to cover half the hospitals in the state, we actually do way more strokes outside of MUSC than we do on our own campus. So somewhere along the line between 6 years ago, or really that program is maybe close to a decade old now, between then and now, our hospital system gave us the permission to hire 15 additional neurologists than we would otherwise need. So if that telestroke program goes away, we got to get rid of 15 physicians. And so that would never have come. You wouldn't be able to take the risk. Of course, we had the investment and those kind of things, but the will had to be there. But guess what? They don't all work for MUSC. Some of them work for a competing hospital right across the street. Some of them are neurologists working in a rural community, but contributing to the pool of doctors. And so the neurosurgeons are still fighting over who gets to do the procedure after the stroke and get those revenues. But the people on the front lines receiving the call have banded together across health systems and are working together. So I just sit back and smile and say, without telehealth, would that have ever happened? And so I don't know how relevant that is to this conversation, but it feels relevant that if you can communicate, maybe we can work out some problems. It's sort of like standing in line with someone versus being in traffic, road rage versus being friendly. And I see that happening. So I'll stop there, and I'll just say that I'm filled with opportunity. I just have a sense of urgency that if we don't get out in front of it, it's going to not go the right way. But I think it will, because of people like you in this room.
Thank you. Thank you very much. Our last presenter is Cristina Mason, an attorney by training. She serves as Vice President of Government Affairs for the Wireless Internet Service Provider Association, and she leads the advocacy efforts of the association before Capitol Hill and works to give voice to the association's 800 members regarding the policy challenges of delivering fixed wireless internet services to nearly 4 million, mainly rural Americans. Cristina.
Thank you. Pleasure to be here. This is an issue that literally I work every day on. Rural broadband access for our members is paramount. We approach it, however, from a provider point of view. And that's the point of view I kind of want to bring to this conversation. We hear what kind of wonderful applications could happen if we had gigabit speed internet access across the nation. We can make sure the communities that need this access the most They are able to get their telehealth access. They're able to learn. Children will have enriching experiences in schools no matter where they are. We know why internet is important, right? That's not a case we have to make. Even if you just want to sit on your couch and watch Netflix, that is valid. You're allowed to want to do that no matter where you live. That's a valid application. The question is, how do we get this internet access to the communities that need it the most? Commissioner Clyburn is one of the smartest people I know, and I know she has this plan. I'm eager to hear this plan, actually. I'm going to hold her to it. She promised us this plan. I'm going to hold her to it. But there are a lot of great minds trying to figure out this problem. This is not new. This is not all of a sudden we woke up and no one had internet and we don't know what to do. It's not a disaster scenario, although that is a fair scenario to be concerned about. But this problem has been building. It's been kind of, I want to use the term neglected. I don't want to say because no one cares about rural communities. It's just a population density issue. It's one of those issues that it's both economic, political, economic, meaning how much money you can make in any kind of community. All those factors kind of pile in and create the perfect storm of what we have now. So I'm going to take my WISPA hat off. Don't tell my boss. He wouldn't be mad anyway. He's a very nice person. He actually used to work for Commissioner Clyburn. But I'm taking my WISPA fixed wireless hat off, and I'm going to speak to you in a very ultra real way of what the issues are from a provider perspective. Basically, the problem can be broken down into three kind of buckets: deployment, access, and adoption. Deployment and access kind of go hand in hand. Deployment means actually providing a technology to get you internet to your home, whatever that technology may be, and I'll go over them. Access is, okay, maybe the internet gets to your home, but can you access it? Is your home actually connected to that internet? And then adoption is, maybe you have your area, there's a provider deployed, you have access, but for whatever reason, you're not adopting it. The family's just not getting their internet plan for whatever reason, and that's a whole little bucket. So I plan to spend about 5 minutes on each, hopefully, but I'm gonna use some of Mignon's time, I'm gonna use some of my colleagues' time if need be, and feel free to kick me under the table if I run long.
That's my job.
You have long, and you have long legs too.
Yeah, we have
At the Apollo, I'll have the cane pull me off. But it is something I do get passionate about because it's frustrating that we haven't solved for X yet. And I feel like it's something solvable if someone just keeps it ultra real. And that's why I'm taking off my hat. So when it comes to the deployment, and the engineers in the room are gonna throw tomatoes at me because I'm gonna very much so gloss over the technology. So if you are an engineer and I get it completely wrong, keep it to yourself. Do not bring that up in Q&A. But I'm gonna kind of give you a high level of like 4 basic technologies that you can get internet from. So the first is wireline. That's access that gets to your home through fiber, cable. Those are kind of the 2 biggies. That's what your Comcast, your Fios, that kind of access. There's big pros for wired access. It is super fast. It is gigabit speed. You can watch Netflix in every room, have your music streaming, and do your homework at the same time. Problem is, it's expensive. It is expensive to get to your home. Now, when you live in an urban community, those costs are subsidized because you got a whole lot of neighbors on your block. And so it makes sense for a provider to come in and provide access through this fiber or cable because they're going to get a whole lot of customers if they lay that cable on your street. So they make money pretty quickly, and that's kind of actually, they're looking for a pretty wide margin, profit margin. Comcast didn't become Comcast by, not making money. So that's a major downfall of fiber or wire or cable access. It's expensive. Second is mobile technology, wireless technology. A lot of people do get their internet access from that. Pros, you can take it anywhere, right? I can just sign up for a plan. My cell phone plan is expensive, but some people can have relatively affordable cell phone access. And, it's not ideal to do your homework there. That's not something, we as educators and medical professionals would think is the best use or methodology of getting your internet. But it's accessible. Let's call it access. It's access. What's the downfall of mobile? Have you ever driven through West Virginia and gotten lost and tried to make a call? You will not have service. And that service is A, could be spotty if you have it at all. And B, if you do have that service, it is slow, it drops, you can barely connect. It's 3G, sometimes you see 1X. Like, this is not helping me, I can't make a call or have any internet access. So that's a problem in communities that already are out there. The West Virginias, the Nebraskas, in downtown DC, sometimes you can't get good service, so let's be real. The third technology is one that I represent, but again, I'm gonna take my cap off and keep it ultra real with you. It's called fixed wireless technology. It's essentially point-to-point, line of sight, beaming of internet to your home. That is not the technical explanation. Again, engineers are gonna throw tomatoes at me. But essentially, it's like Wi-Fi on a county level, where basically a backhaul comes in from the major town, and our providers take internet from that backhaul, it's usually fiber, some other technology, and then they use towers to beam it across the county and get it to your home. And you put a little antenna on the side of your home, you get the internet, and you plug your modem in and you're connected. It's great technology. Pros, it is super cheap to deploy. Our guys can deploy this service overnight. A lot of our guys get started by buying used equipment on eBay for pennies on a dollar because their community doesn't have access. They're largely rural providers because they're just fed up and they're like, you know what, I can't get internet. I want to watch Game of Thrones and I'm going to set up this network so that I can get access. That's literally how 90% of our 800 members got started. So it's super cheap to deploy, and as long as you have line of sight, you can get access, and pretty good access. It's speeds are comparable to, depending on a lot of technology, but speeds are pretty quick. You can watch your videos, you can do your homework. The downside is that you need that line of sight. So if you're in the bottom of a ditch or a bottom of a valley, you're gonna have some problems. Now, it can take a very creative provider, they can get that internet to you. But guess what that means? Money. Time is money, right? So why would I, as a provider, although I should be altruistic, I should make sure that I take care of my fellow man, but unless I'm making money off of this transaction, or unless you have 17 neighbors with you to justify me building out this whole network, the likelihood of me doing a special line of sight just for your home in the bottom of a ditch is low. And it's unfortunate, but we'll get to kind of where the government comes in. And then fourth technology is satellite. So we all know what satellites are. Flying around in space, beaming internet down. For the most remote areas, some would say this is probably one of the better options, because as long as you have access to the sky somewhere in your home, you can get satellite connection. There are downfalls of this technology. One is, a lot of times they charge by the data. So it's similar to those who have non-unlimited mobile plans, if you're being charged by the megabit, you're not going to be able to have the same kind of access as someone who has unlimited access. It's going to be costly. You're not going to be able to, you're going to use up all of your access in the first 10 minutes of Game of Thrones. The second issue with satellite is it's subject to weather. So yeah, if you live in Arizona in the middle of the desert, satellite probably will work out for you, right? Because you get sun all day and there's no clouds. If you live in South Carolina and it's hurricane season or rainy season, you are not getting internet. They are not getting through those clouds. Anybody who has satellite TV knows when there's a strong thunderstorm that comes by, you're going to lose your service. Similar with internet. So those are the four major players, though, in this landscape of kind of urban is different. Urban access, that's a whole different ball of problems. But let's focus on rural here. And those four players are kind of king. There are other technologies. There are hybrids of these networks. Everybody kind of works incestuously. So I don't want to be overly simple, but just for the purposes of this discussion, let's pretend this is the landscape. So we have four providers who have pros and cons of each, four technologies. Why do I still not have internet? Here's the problem. Population density and economics. The profit margin to get to any single home has to make sense for any of these providers. Comcast, who you would think would have the means, and I'm not picking on any companies here, I will pick on my own providers. Again, my hat is off. So if like CTIA is in the room, save your tomatoes for tomorrow and throw them at me then. So I don't want to, I'm going to pick on all the technologies and folks. I'm going to get all of you guys, so don't take it personally. But the problem here is that Comcast, although it's or Verizon, or choose mega company, although they're a multi-billion-dollar corporation, they didn't get there being stupid. They got there because they keep ultra strict profit margins that they have to adhere to. And if your community doesn't make economic sense for them to deploy, then they're not going to deploy there. Second is propagation, your landscape. Our providers would love to service everybody, but some people, for example, satellite and fixed wireless, some people we can't service just because of where you are, the technology, the landscape, etc. And mobile, the same issue is kind of the population density issue, is that they can build a tower, but for the investment of that network, does it make sense? And that's why I'm going to kind of carve out a 2-minute diatribe on 5G. Has everybody heard of 5G? 5G is coming. It will change your lives. You will be able to be a supermodel and rock star because you will have 5G access and it will solve this problem for America forever. You guys have heard it. It's a brilliant marketing plan. Honestly, these people make a lot of money for a reason because it's brilliant. I want 5G. I don't. Let's do it. Why are we holding up? Let's sell our children and have some 5G. And we have to beat China. Remember, we have to beat China in the process. Here's the problem. 5G is perfect for urban applications because the way the technology works, in theory, is that you have to use something called spectrum. And spectrum is really important for the people I work for because that's how they beam the internet to your home. Spectrum is the same thing that if you listen to the radio waves float through the air and you can hear it, that's spectrum. Well, the spectrum that they need to get these super high gigabit speeds that are like 5G, that you'll be able to download or watch anything in a spectacular speed, needs this like really key mid-band spectrum that is both, goes a little distance, but also can hold a lot of information. And that's a tight amount of space. But the problem is it's limited by distance. because the further out you get, the less information you can send. So in order to deliver these speeds that'll let you, catch up on the Real Housewives on your phone, and while also streaming everything else in the world, they have to kind of be right up on your house. And so to make that make sense, economic sense, urban communities are where they're going to start, because you're going to have a lot of people who are going to be able to sign up for these plans. Now remember, they're not giving 5G out for free. Let's remember that. So only the communities who can afford this access will get this access. Let's be real. Some of the communities that we care about will still not have 5G access because these plans will likely be costly. But that's my own diatribe. When we're talking about rural America, they can. Anyone can do anything they want. It's not economically realistic, based on population density, for these towers to be able to get the 5G signal to the homes in rural America without literally hanging the equipment right out front of your house, essentially. So that's fine if you live on a block. Every block is going to have, you have your 9 homes on your block, everybody gets their 5G access. If you're the single home in a 48 square mile area, you're not going to get 5G. I'm just going to ruin the secret there. Surprise, you won't have 5G for a long time. So what do we do in the meantime? The government cares about this, and that's why we're hearing so much about this. What do we do to make sure that these rural communities, these under and unserved communities have access? What a logical thing is, let's provide money. Let's write a check. What do we have to give you, providers, to make the economic case of delivering your technology to these communities? And that's why we have a lot of great work, actually, being done by the FCC, by, USDA has a rural utility service, and all these people are putting together pots of money to say, hey, how much do you need to connect all of South Carolina? How much money do you need to connect Nebraska? We will stroke the check. So the money isn't the issue, because there is money there to bridge. But why are people still not connected? And one solution, at least from, now WISPA hat is back on, is that policies to date have not been technology neutral and size neutral. Historically, the money that's been given out by the government has favored one technology over the other. Way back when and this isn't way back, actually, this is only like 15, 20 years ago that they started incentivizing broadband deployment. So most of us in this room, 20 years is not that long ago at all. To be fair, this is still a very new problem. But 20 years ago, when they started giving out government money to deploy, they were like, telephone, dial up, the kind of one single technology that's basically wired. It was a wired technology. And they evolved, and then it was mainly like FiOS, so the fiber and cable, and that was incentivized. And they were giving out lots and lots of money. I think former commissioner can speak to how much money FCC has actually written checks to get this problem solved. And yet folks are still not connected. You know why? Because one technology is not going to solve the problem. So even if the government pays, say Comcast, we will literally pay for you to run a line down Main Street, rural America. It still doesn't get that last mile. So that last mile to your home. As a lot of us may know, a lot of homes in the country don't live on the road. Your mailbox may be on the road, but your house is 3 miles down Bob's Road to where you take a left, make sure you don't go over that way, go this way, and then you'll see my house in the corner. Comcast isn't running their lines from the street to your home. They'll get it to the street, and if your house is in reasonable distance to the street, it'll make sense to connect. But if you're on Bob's Road that is not even on a map, you still don't have access to that fiber. So that technology is not complete. You need that last mile. Problem is, folks like my providers can provide that last mile. You have that line of sight. We can take it from the fiber on the street to your home. But the problem is FCC, for whatever reason, I don't think it was personal, just didn't contemplate fixed wireless. All they had in their mind was fiber, fiber, fiber. Fiber is going to solve this. So the money couldn't be applied to our providers to allow us to do that last mile. This last round of funding became a little bit more tech neutral in the way that it was written. It's called CAF. CAF2 is the working technical term for this funding.
Connect America Fund.
Yes, sorry, I'm glossing over again.
We have a tendency to do that inside the Beltway.
We
so
do,
sorry.
I apologize. So
all right.
Connect America Fund is this fund that I was speaking of, that this round of funding was a little bit more technology neutral and allowed players like my providers to play in the landscape. And we believe that this will allow way more access, because now you have the big guys who, yes, we need fiber. No one says we don't need fiber. But we also need small providers to provide that last mile deployment. The small providers, that's where I come with so it needs to be tech neutral and size neutral. A lot of times the way American government is set up, it favors big companies. Not because America likes big companies, it does, but because they're in a better position to hire regulatory lawyers. They're in a better position to hire accountants and CPAs and get their financial house in order to compete for this big bucket of money that's really important. Me, a provider that has 3 employees, I service 3 counties in Nebraska, I'm just not equipped to even compete. You know, I would love to have an extra $10 million to build out my network. I would service all of Nebraska. I don't know how to do that. I don't have an attorney. I just, service my neighbors. I make sure my QuickBooks are up to date, and I make sure my technology is working. And so the way things are structured right now, they don't favor small businesses, and we're working on that. And FCC is actually committed. They have actually indicated that they understand this is an issue, and they're working to address, hey, how do we allow smaller providers who can make the economic case to go right to your home? Because to them, their profit margin is way smaller. They don't have to worry about shareholders or making sure their profit margin is at a certain percentage. They can kind of make things work to make money off of you. And so they'll figure it out. And that's why we have to make sure that policies that incentivize rural broadband development are not only tech neutral, but size neutral. So that was deployment. I'll gloss over really quickly access and adoption. Access goes hand in hand with deployment for the reasons I outlined. So you can have fiber to your street, but if your house is 10 miles down the road, you're not going to get that access. And that's something we can solve for X by having a small provider in the area helping. Adoption. This is key because a lot of times people forget about this. We can have all the access in the world, but if you're internet literate, I'm trying to be diplomatic in the way I'm saying this. If you're not internet literate, so you don't understand why high-speed access will help you. My mom is a perfect example. I could pick on her, she's not here. Brilliant woman, college educated, put herself through school, blue collar, Philadelphia, and lives actually in Philadelphia. She had dial-up access up until like 3 years ago. Why? She couldn't understand why she would need high-speed internet. Why would I need high-speed internet? She didn't watch Netflix. She didn't, do mobile banking. She didn't need telehealth. She'll just hop in her car and go to the doctor if she needs to. she didn't understand the importance of high-speed internet. She didn't have a laptop. She didn't have any technology other. She eventually got a smartphone because they stopped selling like the basic phones. But she didn't understand the need for high-speed broadband access. So what did I do? I bought her an iPad. I was like, Mom, she was like, no, I don't want to use it. I don't want to use it. Mom, just try the iPad. It changed her world. I sat with her for an hour, taught her how to use the iPad. She could get her email, got her Gmail set up. She could have email. Here's the kicker, and you guys know what I'm going to talk about. Facebook. Facebook changed her life. She could see her grandbabies. She could see her cousins who lived in California. She could have all this access to this wonderful technology, and all it took was some education of this is how you can use it. So now she has the highest plan from her cable provider. She has internet access. She downloads the photos and prints them out and now feels more connected to the world. She has online banking. She checks her tests for her medical from her doctor. Changed her life because she learned how to use the internet. And so that's kind of the adoption issue in a very simplistic way of that you could have internet. She has all the access in the world. She had Comcast, or she could have access at Comcast, but because she didn't know what this could do for her, she didn't adopt. Now, another major part of adoption is, the most obvious, cost. And that's something we have to figure out as providers, as public policymakers. How do we make sure that the communities that can't afford access can afford it? And that's something that we're continually solving for X. There are programs, access programs that do work, as long as you qualify. But a major point is that we need to figure out ways to keep it affordable too. We can get internet to anybody if they're willing to pay for it. If they're gonna pay $1,200 a month for access, anyone can have internet. But if you're trying to keep internet affordable and quality internet affordable, we have to figure out ways to incentivize deployment that makes sense. And I'm gonna leave you with that technology neutral and small or size neutrality are the two things to keep in mind as we debate policies to get these things done. Thank you.
Thank you so much. You guys have had a chance to hear what each other's had to say as well. I want to give you maybe another moment to make some additional comments, and then we'll open up the audience for questions.
Well, Attorney Mason mentioned quite a few things, but I will semi-weave what was on my mind earlier as we go into the second half of the panel, which includes you, by the way. I'm sorry. He's used to me kind of...
bossing me around.
Yeah. So I don't call it boss, just encouraging him to see it my way. But one of the things that I believe that is the biggest barrier that we have, no matter if we're talking, communications, ICT, information communications technology, whatever it is that we do think, in this world, the biggest barrier from where I sit is challenging notions, challenging preconceived, cultural or business norms, that's the biggest thing. And I'm going to give you one international and domestic example, and I'm going to name names because I can, and they're not a client. I had the opportunity in, I think, my third year at the FCC to travel to the Gambia, my first trip to the continent where I have an affinity and an obvious connection. And I saw individuals in the Gambia, Senegal, and Ghana, that particular trip, defy a lot of preconceived notions. So back then, there was a lot of investment from these international communications companies to go wireless. They were connecting these emerging markets, which honestly I chuckle because Africa was the market. But anyway, that's another panel, and still is, especially when it comes to raw materials. They had this projection, these companies, that they were going to make this investment for mobile, mostly voice service. And it was going to take them 5 years in order to realize 50, 60% adoption and penetration. You know how long it took, the average? About 8 months. They looked at the numbers, meaning that my service would cost an average person from the Gambia about 120% of their annual income. That's what it's going to cost, because again, we are talking in terms of earnings, at least earnings on the books. This is what it's going to cost, and there's no way in the world in the short term that these are the numbers, these are our projections. In every single country, and I got up to 7 that I visited, the same outcomes. Why? I don't care how economically challenged you are. You want to communicate. You're going to find a way to connect to your friends and neighbors. You are not satisfied in your own cocoon without having safety protocols. You are not satisfied. You're going to find a way to make it happen. And that is what these companies did not factor. Fast forward and coming back over to the lower 48 and the two states that remind us that we have a lower 48 mentality. I'm going to pick on Comcast. One of the most interesting and dynamic, and they will tell you offline, discussions that became a little audible we had during one of the transactions when I was a commissioner was when they were developing their Internet Essential Program, which is the program that addresses the affordability factor. You get high-speed internet access for under $10 a month. They had projections about how profitable it would be. They had their protocols, in place about who should who should qualify. It should strictly be, those who qualify for free or reduced lunch. I immediately countered and said, what about those who are just beyond that really can't afford? They make $2 too much to do this, but not enough to be connected. Within a couple of months, they expanded the program. Within a year and a half, now it's open to veterans. What I'm saying is this. Corporations have a certain DNA. And their DNA and their business models rarely, if ever, meet the communities of need and their interests. That is why you have government agencies like the FCC that are supposed to fill in the gap, because we know that the market is going to act the way the market acts. They're going to answer to their shareholders, and they're going to answer to the bottom line. Lovely. I'm not pushing against capitalism, especially if I benefit. I'm fine with it. But what is the problem is that check and balance that a lot of the agencies, including my old agencies, which I care for a lot, if they have a market-based mindset and concentrate strictly on infrastructure and not affordability and the rest of those 3 factors, Ms. Mason, start to call her by his first name, Mrs. Mason, mentioned affordability. She mentioned, digital literacy. There are multiple factors that are preventing individuals in our communities from coming online. It is not just the infrastructure, and to get the congressman upset with me, it is not just in rural areas where we have this problem. So part of the multi-pronged challenge that I just named, I'm going to call this Project Hidden Figures. I like it. The plan is still developing, so just embrace the name and know that it's a word to go. We need to ensure that the investment and the focus is 75% targeted to those communities without. 75%, and I'm not arbitrarily, because what is not happening, going with those two examples, is that the numbers, with all due respect, of those who are disconnected are actually in those urban communities where you do have scale and scope. But if you redline in those communities, okay, I know I got a mirror, then you get much of the same. So I'm going to go over a couple of things that you didn't ask, but you knew I was going to say. A couple of things that, and you asked for a summary, but you knew when you called back on me that it wasn't going to be a summary. Here is what this now fourth industrial revolution has brought us. Awesome technology, awesome opportunities. But what it has also brought us is income stagnation. Why? There are two primary beneficiaries of the last half of the third, and now the fourth industrial revolution. Low wage, low skilled workers, and I say benefit in a very, very, I don't even know my SAT word, a very uncomfortable way. Because they have jobs, they just don't pay. And high skill in the innovative class, those technologists, those app developers, those individuals at the CEO, they dropped out of college. Some of them have PhDs, but most of them dropped out of college, and they're the Uber billionaires, not Uber the app, the Uber billionaires, of the day that you see, wearing hoodies, but they can wear hoodies. But that's again another panel. I'm sorry. Let me come back. So those two extremes, the economically challenged, the most economically challenged of the economically challenged, and the richest of the rich, they are benefiting and will continue to benefit if we don't drop the R off of revolution and do something differently. So my project, Hidden Figures, would hopefully disrupt some of that. And the one thing that I wanted to start with, but I start with because the mirror is on my left. You hear a lot of talk about smart cities. Again, exciting. The mayor has been at the forefront with his previous two national posts, and one of the 3 or 4 cities that has benefited from a grant and attention. Columbia, South Carolina has been one of them. So again, Mayor Benjamin has been a leader in this space. But when you talk about smart cities, and I sit in these conversations and in these, I hear the grand plans. I hear, about, the prospect of 5G and small cells and just being able to penetrate those old buildings and offer all of these awesome speeds and awesome opportunities. But I rarely hear the community where my parents still live because they refuse to move, that is literally across the tracks. Seriously, I can hear the train. We live on the other side of the tracks. I don't care how Jim Clyburn looks, he lives on the other side of the tracks. Those communities, those pockets on the other side of the tracks, with those homes that have holes in the floors, They're not included in these smart city master plans. They have to be. Their needs, and which are in essence the needs of the city, if they're addressed, then that's the tide that will, pull, that binds. That will lift up. That needs to happen. It traditionally, in the first 3 revolutions, did not happen. They were afterthoughts. They were laborers, not beneficiaries. And the communities looked the same because even if they had an initial benefit, it wasn't sustaining or long-lasting. That has got to happen. And that's got to include digital entrepreneurship opportunities. It's got to include new skilled development programs, workforce training, because what is true about this modern revolution is that it is very disruptive by way of the jobs of today. The jobs, Carolina, saw its, the industrial, the mills, that's gone. Textiles, can we still spell it? We don't even talk about it anymore because that part of the economy is gone. The things that's thriving, the communities, the industries that are thriving, last time I checked, tourism was the #1 industry in South Carolina. Tale of 2 extremes. Those people who help keep your rooms clean and service, they're on that low wage side of the equation. Those who own the hotels and other businesses, they're on the high. So this is not just technology, this is hardwired in our DNA. So it's not new. But what could be new is our approach to addressing it, to making sure that these benefits are more neutral. Again, the hidden figures includes those in these communities that know what they need. They even have the answers, but they don't have the economic investment or bandwidth. They're not listened to come in their meetings. When they have CBDG block grants, they seem to qualify for the application. That needs to change. And so we truly want to have a more inclusive environment. We have to offer incentive to broadband deployment in underserved areas, all underserved areas, not just rural. It's got to include, and so the FCC needs to reshape and rechange its paradigm when it comes to this universal service program and include all unserved communities, not just rural. Look, I'm not against rural. You've got to know I'm not. We still own, I still have an accent. I'm just pretending right now. I am rural to the core. But I understand that if there is not an uplift in terms of urban communities, then the rural communities will suffer. Because if it's healthy and done right, they're a complement to each other. They help serve and uplift each other. And if one suffers, the other ultimately will. And I can't help, and there are other things here. We can talk offline, and with healthcare. Because one of the things, and this is a part of what I wanted to talk about in terms of government and its approach, which is incredibly siloed. Let me use the FCC as an example. Lovely agency, again. It is divided into bureaus and offices in a very traditional way. It, not unlike any other government bureaucracy, can be extremely rigid and slow to change. I'm not faulting them. That's just a part of the DNA of most organized entities. And if we're honest when we look in the mirror, that's the DNA of us. We're slow to change, especially if we're comfortable, if it's working, and if there is no incentive to change. Because one of the things about government, honestly, you're gonna get your paycheck, and I'm not saying that people are satisfied with doing the same. I'm saying there is rarely, if ever, a stick that will encourage change. You have to be that stick. If you want that, I think you want, because that's why it brought you in this room, the outcomes to change, then you have to be an agent of change. Again, healthcare. A few years ago, the FCC, and I'll take a little credit for this, came up with, we've got our own, rule, healthcare portfolio inside of the FCC. It has educated the FCC to the point that it is considering a rural healthcare pilot. It really is a strong team that is a Connect to Health program. When you hear me, I couldn't remember the name of the program that I helped to create, but it's called Connect to Health. Healthcare, as you heard from the doctor, is increasingly being delivered wirelessly and digitally. We incorporated in my family telehealth within our home, and it's truly made a difference. Now, my mom's in the hospital today, but part of the reason she is because there was an alert that was sent. The nurse called and said, you need to go in. Now, again, I point that out because there was resistance from the agency to move further into this realm. There are a lot of people going like, what does the FCC have to do with health? And I'm like, ding, 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 excuse me? We're moving into a digitally connected, mobile, totally wireless ecosystem where the boundaries, the current boundaries make no sense. That's why we're a part of the equation. If you don't have a connected community, you don't have telehealth and telemedicine opportunities. If you don't have a connected, hospital or a connected, a rural medical center or a connected office, you cannot provide, you cannot do anything with electronic healthcare records and the like. If there is any one common denominator here, and I know some people might argue, other than having food and water, that's a physical necessity. I would say the third necessity is connectivity. It is the seed to key to everything we're speaking about, and it could be the disruptive element for us to get rid of all of the traditional 1, 2, and 3 industrial revolutionary outcomes that we could have in this 4th revolution. But if we're passive, if we get listen to others, when they talk about this and 5G and a lot, and we get so swayed about how we could individually benefit, and not pay attention that the needs of every other, the majority of others, are not included in this paradigm, then not only will we have those 2 extremes, they're going to get more extremes. I'll pause there because I want to leave time for questions. And our doctor didn't have his final minute because I took up all of the rest of his.
That was wonderful. And what I want to say, and it's quick, I promise, and I'm not always quick, it takes effort, is if my job was to come here and reinforce what these fine ladies are saying, that we can use this connection, I'm not sure I did that. We have over 500 sites connected across South Carolina with video to help care sites get better access to specialists and things. There's only, 46 counties in our state? Yep. We're dense. We can do this. Right? We can do this. We can reach homes. We can solve healthcare problems. I want to say that 100%. You asked me 5 years ago when I first started down this journey. I'm not a tech guy. I was a naysayer. It can happen. But I think what connects a lot of what you all are saying is that the problems are local.
Yeah.
And as we move to subsidize this, as we move to try to get to that last mile, I think hold the users of the broadband and the internet to their goals. Make them state their goals, that person who lives 3 miles up the road, that he's not left behind. We can do it. The healthcare can do it if I'm told to, but we're not going to tell ourselves, unfortunately, because the economics are going to tell you something else. Mm-hmm. So as you go forward and you support funding, you support these other things, hold people accountable and hold them accountable locally. That's what comes to mind.
That's fantastic. Thank you. Thank you so much. We have some time for questions, sir. And identify yourself as well, if you don't mind.
Hi, my name is Wes Gobar. I have 2 quick questions. One, with this 4th industrial revolution, something that will be a main driver is our response to climate change, as well as climate change itself. And I've heard a lot of talk about 5G, and one concern is that it interferes with weather forecasts. We have extreme, more and more extreme superstorms that are going to be coming, and we need to know very quickly when the storms are coming, what damage they'll do. So if you could address that. And then also I would love to hear thoughts on municipal broadband. Very important to getting fast gigabit, or cheap services to urban communities, as well as electric cooperatives then using broadband as well, which is probably one of the cheapest ways to get to, the cheapest and most effective ways to get to rural communities outside of using Comcast or anything else.
So I might fall short on the first one, so I'll start with a second. One of the things that has always bothered me is that, and this goes back to something Ms. Mason mentioned, is the legacy thinking of policymakers. And this is why, when you mentioned the municipal, broadband ecosystem, this is why. The previous administration made an attempt to allow local communities to be able to provide and enable hyper-local broadband opportunities. Translation, letting a community, if a city or if a municipality wanted to create its own broadband network, that it would be able to do so. Now, we lost that in court. We lost that. With all due respect, I think I am about to step on the toe of a client. That the internet service providers, the larger incumbents, did not want change within that ecosystem. Now, many of them were not providing opportunities and broadband to some of these communities, but they didn't want that change. So there were a number of laws, to include the Carolinas. There are about 25 states that put really extremely high barriers for those local communities who wanted to create their own systems to do so. Part of the argument, and I'm not going to argue with this side, though I don't agree with it, is because these are municipalities, they have an unfair advantage. They've got, a financial base and the like, whereas private industry has to go and do their own dollars, the regular way. It's like that elephant in grass. The people still suffered. The people still did not have. They went to these large internet service providers and asked for them to come in their communities, and some of them were actually laughed out of the office. And so that is a part of the problem. So it can't be just a no. How do we get to yes in terms of serving these communities? Now, the other one that I told you I might need a little bit more thought in terms of the climate change. I think you said climate change, response to climate change and 5G.
But
Yeah, Cristina might be a little more quick.
The difference between 5G and some of the methods they use to detect storm systems.
Oh, okay, got it. Christina is better with that one. Thank you.
Okay, so I do have thoughts on both of your questions, but quickly, first one. So what you're talking about is you're concerned about radar or the
Interference.
The interference.
Okay.
So I alluded to spectrum. Within spectrum, there are allocated bands. The FCC does an exceptional job of regulating this space. This is something they do proficiently, effectively, and take very seriously, because not only weather forecasting and et cetera, but our national security interests, major electric utility, water utility. There are major uses of spectrum, these spectrum bands. And so they are very well protected. So the 5G spectrum access will be predominantly, those bands will be cleared in a way that prioritizes whether national security, some of the other key policy priorities of the government, and FCC makes it their they take this very seriously, all as well as the Department of Defense, Navy. Everybody cares about making sure there's no interference between the same wavelengths that you need to get this radar and sonar, et cetera. Well, not sonar, but radar technology, and the 5G spectrum. So there are protective bands that are in between the prime bands for 5G and then largely the lower bands that do the weather forecasting and kind of national security. But they take precedence.
Right. And you're right. That's why you have to have one, because when a brain, when the brain cells don't get enough oxygen, then what she said. but those buffer zones should that she's mentioning should be adequate to help with that. It's not a perfect science, but it's one. You're right that that department within the FCC.
And anytime an industry wants to enter a new band, they typically have to provide a study,
Exactly.
An interference study. So we just conducted an interference study for a band called C-band, where we could demonstrate that our technology wouldn't interfere with the incumbents in the band. And they require that before you even apply for the band. So that should be okay. Second, in terms of municipal broadband and the rural electric co-ops, again, I want to emphasize tech neutrality. So I believe in an all of the above approach to rural broadband and access. If the rural electric co-ops can do it, great, let's get them there. But I think we should need to make sure that perhaps they can get us maybe 75% of the way there, but let's keep our creative thinking caps open to maybe hybrid approaches where, for example, our industry is actually partnering with the rural electric co-ops, that the co-ops can wire their existing infrastructure. They have the poles, they have the wires, they do have to do a significant amount of upgrades to make their infrastructure be able to deliver gigabit broadband access. But a lot of times the price of delivering that last mile doesn't make sense for them to deliver to each house. And that's where our guys come in. So we're partnering with the rural electric co-op saying, hey, you wire this county, we'll do the last mile service, but we'll charge the customer one price. They'll just see one internet access. We'll, on the back end, have a deal with the electric co-ops. Your farmer gets his access. He's allowed to do his precision agriculture, have high-speed internet. We, the small guys who are more able to do that last mile, get the business. And the rural electric co-ops, have their infrastructure used to the best of its ability, and everyone's happy. But it takes creative thinking like that. You can't kind of just say, oh, the electric co-ops are going to take care of all of it and check that box and give them $65 million and they're done. We have to think of the actual practical applications of, does it make financial sense for them to actually service all of America, or are there hybrid partnerships that we can envision that actually gets this done? And same for municipal broadband. Some people would argue that perhaps the last people who should get into business is a local government.
So this is when we friends start disagreeing, but
some would argue that. I don't argue that. Again, I'm all of the above. If it works, it works. But again, let's keep options open for partnerships for small providers and folks who are already on the ground doing this work. Why reinvent the wheel? So that's just something I would leave you with.
And allow me to put one thing in historical perspective, because I'm not sure. I recognize one or two people in the room, but everybody might not know. So this is when I put on my rah-rah FCC, I'm going to defend them till I die hat. The FCC, is an 85-year-old organization that is responsible for commercial spectrum. And so you've got an agency that there was a representative here earlier that does government spectrum. The FCC is the commercial spectrum, agency. And so with its programs, the major program that helps fuel a lot of what we're speaking of today is called the Universal Service Program. It is an almost $9 billion a year, billion with a B, a year program that helps stimulate the economy, from a communication standpoint. The largest fund, it used to be called the High Cost Fund, which made kind of intuitive sense for me, but it's called the Connect America Fund. You heard Ms. Mason say CAF. And we're almost into sort of pre-phase 3, I guess. I don't work there anymore, so I'm kind of decompressing. Right. Right. And so that $4+ billion, annual, some would call it a subsidy, is used to bridge the economic gap for those in rural communities, those companies where the classic economies would not work. If you were to leave it alone with no subsidy, we used to call example used to be in Blenheim, South Carolina. It might cost $120 a month for basic phone service. So you fill in the gap because we said affordable, then voice phone service is important to everyone in this nation. If I, in rural South Carolina and rural wherever you're from, am not connected, the entire communications ecosystem, the entire state, the entire nation does not benefit from us not being connected. So that fund is to bridge that gap, and the beneficiaries economically, the check is written to those companies, those communications companies that provide now internet service as well as voice. They get a check every month to help fuel this. The second program that everyone knows about, is aware of no matter where you live, is called E-Rate, or the Schools and Libraries Program. That's about $3.8 billion. Subject to check, I'm just throwing billions out, but it's billions of dollars that meets the gap or the need with schools and libraries in communities, schools, especially those with free or reduced, lunch, protocols. And so there is a gap that is being filled. So schools and libraries, if they apply, would get, money to meet that economic gap that they could not afford on their own. The Lifeline program, which is something I'm passionate about, is the only program that is non-infrastructure oriented. The Lifeline program is a subsidy, $9.25 per individual family that would qualify if you cannot afford voice and or broadband service. The company in which you sign up with gets a subsidy, and you can have monthly service. So that's the program that you heard about that has been demonized over the years, but it's the only true affordability program that the FCC has. Everything else is infrastructure. And the last one is a much smaller, but it got a little boost, is the Rural Health Care Connect program, which does just what it says. It has a 60% match. Well, it allows for a 60% subsidy to a healthcare center or the like to provide broadband or connected opportunities, so they can indeed have electronic medical records and all of these things. So I wanted to bring that up to say this. One of the things when we were going through reforms at the beginning of the last administration that we did, that all of you know, especially if you're in government, sometimes you make decisions that might be efficient, might have forms of effectiveness, but that is not necessarily one that you are 100% comfortable with. And I say that to say this. We talk about neutrality when it comes to technology. That was the one time we were almost unapologetically not neutral. The commission decided that it wanted to provide broadband-enabled services in the quickest way. And it concluded, and I was there, so you can throw the tomatoes a day, because I have time to shower, that dealing with the existing companies, which were largely the traditional internet service providers or communications providers, would be the quickest way to get broadband out in these communities. Those who were doing it and doing it relatively well would get first dibs. And we decided to do that. Again, you can criticize it, I have. But we decided to do speed versus maybe some people's perception of fairness. Fast forward to now, I don't think there's a need for that. And that's what, Ms. Mason, did I call you Cristina accidentally? I'm sorry if I did. That's what, Mrs. Mason, was speaking of there. You do things sometimes in a short word to address an issue. you shouldn't ever stay there because it technically disadvantages and has a potential to disadvantage, emerging technologies. And so I wanted to explain why Ms. Mason rightly brought that up, but just wanted to give you a little historical context as to why.
All right. Sir.
My name is Dr. Aria from Mahal University.
You said Alan?
Alan.
Okay, all right. I had to say that because that's in Columbia. Yes,
Oh,
thank
yeah,
you.
yeah, that's good. Very fantastic presentation by all of you, and I'm glad to be part of this. I'm just curious to know how aware are the people at the rural level about the intervention gadgets that we're talking about on a scale of 1 to 5, 5 being not informed. And again, what do you think is going to be the very best approach to make this affordable to them? And as we're talking about all this broadband and all that, how practical has it been to have some kind of incentive deployed to rural areas so that it can actually be affordable at that level? I'm just curious to know all of that, please.
Well, I think the
If you could maybe restate in your answer.
Sure, yeah, I'd have to. I think it probably crosses all of us about how do we make it affordable to the local folks, whether the healthcare intervention and then the connectivity that is needed to do it, I believe is what the question's around. And first of all, from the healthcare interventions, they're still not designed completely to be reimbursed for the folks that we're talking about. And so that's still an issue. But I'd have to say that Medicare and others are moving in the right direction. And just in the past year, we've gotten newer codes that allow these so the mission statement for our Center for Telehealth at our university is actually efficient, effective care. It doesn't say a whole lot about technology because it has to be more efficient. So I feel very optimistic about it. We're out in front of it because we've had government help and we've been asked to go to those rural areas. So it's a bit of a catch-22, but we're getting there. But from a technical perspective, these ladies could speak to better how that subsidy might work for the small place.
One of the things that I mentioned that I would like for you, to look at, even though I think the comment period has closed, there is the FCC released a rural healthcare. They're looking at doing a rural healthcare pilot that again that people have weighed in, and it would be curious to see how that is structured. It is another phase of what MUSC, I don't know, but maybe it was before you got, the number of years ago, MUSC was a beneficiary to over $7 million that helped to connect and to have a partnership with other rural communities. And this is what I liked about this program because it's how we should think. We said the application would be stronger if you have a strong anchor institutions, with MUSC was. But 51% of the benefit had to go to rural communities. So you had 49% that MUSC had the latitude, to ensure that some of the local, more urban communities, but 51% of the benefit. So what does that mean? What it obviously means is people in those communities benefit, but how they benefited was having those technologists or specialists at the medical university being able to communicate with doctors out in the rural areas, and you allowed for telehealth opportunities to be, gained in areas where they didn't have the benefit. So that high-risk pregnant woman does not have to come 120 miles outside of the PD area to go down to Charleston to get care. She could get care with the assistance of, and I saw it live, and it's remarkable, with the assistance of a specialist, and that helps everybody along the supply and a chain and along the healthcare delivery chain. More examples like this, building on that which this potential next phase of this healthcare pilot could do that. And this is the type of mentality we need, not trying to think all siloed that it has to be 100% rural, it has to be 100% this or 100%, because the talent is in multiple places, and the benefits should be derived in more places. And if we compound and unsiloed and decouple a lot of the delivery matrices, however you conjugate that, then I think we will net better results, not just in healthcare and just about everything that because you're in South Carolina, there are very much disparities in Columbia, South Carolina. I'm a product of Richland 1. Richland 2 was always better, and Richland 5 was always better. And then there was always this in terms of outcomes. Why? We know why. Technology can decouple and disrupt that, but it has to be ubiquitous. It has it has to be accessible, and it has to be used in a way that will uplift communities. Streaming and the rest of that is fine because I think you need a balance. I don't have one, but I think that the world works better with a with a balance. But we need to make sure that those opportunities exist and they are not equitable.
Thank you. Other questions? Microphone moving around. All right. Well then, Willie, we good to go? I'm sorry, David, we good to go? I give both of them a hard time. They both guide me in the right direction all the time. On behalf of the Majority Whip, I know how deeply important this is to him. And I said last night at the reception that Jim Clyburn could probably have retired in 1992 and still have had a life worthy of the history books. Just the doors that he opened and ones that kicked down in South Carolina for so many people. But he chose to come back and serve. And it's amazing when you talk to him about some of the most incredible things he's done as a member of Congress. It goes to these types of issues, deep, making sure that communities have clean water when it's not a priority for anyone else. And if someone's not advocating and using the levers of public policy to push capital in the right direction, to fundamentally change people's lives, it just doesn't happen. And to have these three incredible individuals serve as a part of the Braintrust this year is, I believe, elevated it, and it will make him very proud. And I'm glad we have, again, a record for posterity. Thank all of you who made this a success over the years and continue to do so in 2019. We've got a lot of work to do. Let's do it together. God bless you.
Thank you.
Yeah.